Hello, and I am Derek White. I'm going to present my risk management 5103 individual project now. So I'll go ahead and share my screen. Okay. So today we'll talk about risk management of health information exchanges and patient portals. The Health Information Exchange is a clinically integrated network of healthcare organizations and business necessity stakeholders where electronic patient data or related clinical information is shared to promote interoperability of systems and processes. The intent is to improve patient care. So using the Donabedian model, Vedas Donabedian, we are looking at the benefits of HIEs for both structures, process, and outcomes. You'll see the patient portal is an electronic web-based communication tool allowing for seamless interaction between healthcare delivery providers and patients before and after an encounter. Patient portals can be used to make appointments, receive test results, follow up on labs, track prescriptions, submit questions, provide customer feedback, and complete billing issues. Once again, a Donabedian model look at the benefits of patient portals. So it's important to note that HIEs and patient portals are different from EMRs. EMRs are primarily accessed by physicians and are the main patient record. Patient portals, however, are primarily accessed by patients, and they don't take clinical precedence over the health record. HIEs are primarily accessed by clinicians and internal departments, and they're used to exchange patient information outside of the organization or to connect separate EMR systems throughout the continuum of care. Patient portals and HIEs can be standalone. They can be offered as a distinct product or as extensions or models of an electronic health record. So enterprise risk management in healthcare. The American Society for Healthcare Risk Management, uh, known as ASHRM, designates 8 domains of risk management to promote a ERM approach in healthcare. So you see the domains listed here, both operational, clinical, strategic, financial, human capital, legal, regulatory, technology, and hazard. These are all the various categories that risk management falls into. Particularly with technology, this domain covers machines, hardware, equipment, devices, tools, but it can also include the techniques and systems and methods of organization. So you can see that the American Society of Healthcare Risk Management has done great work in giving us a framework to comprehensively address enterprise risk management in healthcare. Technology risk is one of the 8 primary risk domains recognized by the American Society of Healthcare Risk Management, and those specific barriers present in the following ways. There are privacy and data security challenges. There are issues with standardization of policy, governance, format, and methods. There are issues with adoption and meaningful participation in both the HIE network as well as patient portal adoption. Emerging technologies and regulatory challenges as well. So why is mitigating risks for HIEs and patient portals a growing issue? Well, given the pressing need to decrease waste and inefficiency in healthcare spending, mitigating technology risk is of particular importance. Now, we see each risk domain given to us by the Society of Risk Management from Healthcare, and we see here where each barrier presents itself in those risk domains of strategic, clinical, financial, human capital, legal, technology, operational, and hazard risk. Some of the specific manifestation of those barriers show up in mismatches in data. which can produce clinical errors. Trading challenges, which present downstream risk of loss. Cyber threats, which is well documented in current literature. And hazard risks are things that are well beyond our control, such as pandemics and uh, environmental crises and climate crises. So why is ERM important for health information exchanges and patient portals? Enterprise risk management provides a more broad approach than traditional risk management. It allows for cooperative, nimble, and high reliability mitigation strategies. Now, as ERM is further embedded into the fabric of the culture, the frequency of loss exposure should decrease, and near miss reporting can help to avoid sentinel events, which help to skew the measurement of risk preparedness. In other words, avoiding those high cost, high risk, high severity events that can make throw off your measurements of how prepared you are. They can also throw off the measurement of your budgets for risk management. So let's look at the stakeholder perspectives here. So what do patients think about HIEs and patient portals? How does risk management affect them? Well, patients will benefit from better service delivery and avoidance of medical and safety errors. So an HIE will enable a patient to see a provider in a different part of the country with the comfort of knowing that their new or interim clinician will have the best information and the best reporting tools to provide an optimal level of patient care. Now, providers and health professionals, um, for them, they're able to operate with best evidence-based practices without the fear of loss that comes from incomplete patient histories, incomplete records, incomplete registries. And this change of healthcare, this rapid change that we have experienced in healthcare with the ACA and HITECH Act, have produced a culture of defensive medicine. Uh, Malpractice litigation is not uncommon. And so reliable data can alleviate such concerns for providers and health professionals. Now, for employers, both healthcare organization and other related employers where they provide access to care, employers have a vested interest in streamlining the inefficiency of providing coverage. They need to produce better outcomes because the employees share in the cost of the insurance, and they need to insure against poor health and exorbitant expense. So that unique positioning that employers have presents an opportunity, and there's also risk for exposure that is not common with other stakeholders. Payers, what do they have to benefit from risk management and an ERM approach for HIEs and patient portals? Payers have a great opportunity to bend the cost curve as they deliver care, and care becomes more digitized and employs more digital technology. See, in the best scenarios of HIE participation in patient portals, the more adoption we get, we can optimize the digital record enough to have a possibility of getting real-time financial data around whether a change in strategy or a new initiative is going to produce the result that we planned or we projected. We also are able to manage the risk of a hazard event and respond more quickly and more nimbly. So for government and public policy entities, public policy makers have a clear legal agenda to foster this transformation to digital technology, to increase the use of EDIs or electronic data interchanges, and to modernize healthcare technology. Now, nevertheless, the ambitious initiatives that the ACA has put forth, it does require some capabilities that have not quite come into reality and have not come into fruition yet. So many of those standards are still being investigated and are being studied to ensure that we can successfully implement them. So what are the implications of an enterprise risk management approach to the utilization of HIEs and patient portals? So we'll look at the pros And the benefits to using the ERM approach are that you have comprehensive mitigation, means that you have far-reaching, wide-ranging mitigation strategies. You prevent information silos. It's more collaborative. It facilitates better metrics and better measurement of the data regarding your business. The benchmarking is improved, and you're able to benchmark better against yourself and your competitors. And it's nimble and agile to respond more quickly to a hazard event or some sentinel event that presents itself. It also equips senior leadership with the data to make the strategic decisions that are going to uh, promote success for a healthcare organization. Now, what are the dangers in using an ERM approach or the cons, right? So there are some challenges of scope, right? Being able to understand who is completely responsible or who has the ultimate responsibility for an outcome. The more collaborative you become, sometimes those definition of responsibilities can become gray. You don't want to over rely on the approach. There are also contractual limits. Sometimes there are non-disclosure agreements and confidentiality agreements that don't allow for the sharing of information. And the ERM approach also presents more benefit for larger structures. Now, while a smaller organization can benefit from an ERM approach by being comprehensive and making sure that there are no gaps and there's a high reliability approach, larger structures are going to benefit from an ERM approach because they have senior leadership at every domain of the risk management spectrum. So there are sometimes reporting barriers. You have the issues with those who are hesitant to report. You have human capital strategies that have yet to be developed that encourage a just culture. And then there's also hasty responses that can sometimes come from an enterprise risk management approach when people get the data and they respond a little bit more emotionally than from a reasoned and well thought out perspective. And then there's also the common issue whenever we get a lot of data of analysis paralysis, where you're just overwhelmed by all the information that you're getting and not quite able to make a clear decision on a policy. So let's look at the ramifications and recommendations going forward. Many healthcare technology risk exposures today can be prevented with simple, fundamental, straightforward technical measures. Uh, Patient data communication tools, particularly patient portals, can utilize some of the same security measures as other customer-facing applications. So as a result of the unique privacy concerns resulting regarding health data, it is necessary to use best practices to ensure HIPAA compliance and ONC certification. Now, ONC certification comes from the government's Office of Health IT, and this certification pretty much ensures that a system is able to meet the standards that the government has put forth for being able to transmit the information according to safety, privacy, and security standards. HIPAA, we're all familiar with HIPAA. We need to be compliant with HIPAA as it regards to our approach with our security measures. So what can we actually do? What practical steps can we take? Those who are managers of IT, those who are analysts, those who are security managers, what practical steps can we employ to mitigate these types of risks? So we look at one of the contributors at fqhc.org. His name is John Deutsch. He offers 7 very practical security solutions to mitigate these types of risks. One, we want to have opt-in consent. We want to make sure that people are opted into HIPAA agreements when they sign up for the patient portals and any consents around HIE transmission. There needs to also be an ability to opt out, but we'll speak about that in another section. Role-based access control, right? So we want to make sure that there's a clear function to grant proxy access when necessary, or whether someone should have the ability to administer the program or the application, or those who would have the ability to just be a contributor, those who would just be client facing, and so on and so forth. So we want to make sure we have controls about the roles that people play within that system. Zero Trust Framework is a high reliability tool that's been presented by the Cyber Defense uh, Administration here in the United States. This basically means that anytime someone is coming to a touch point with your device, that there is some kind of access control. At every point, anywhere in the system, there's an access control at every point in the system. And so that's what Zero Trust Framework is about. So the ecosystem oversight, uh, pretty straightforward, meaning that we want to have someone who is watching over the entire comprehensive network, multi-factor authentication and password protection. In my preparation for this, one of the biggest exposures that we found in loss was with shared passwords because of improper proxy access, and for those who were just simply trying to get things done, but the shared password created the biggest exposures. Encrypted backups. You want to make sure that you have backups that are off-site and isolated from your on-site IT infrastructure, and you want to make sure that that backup is encrypted both in storage and in transit. So it's going to need to be encrypted in transit and in storage. And then we want to also make sure that the staff training is sufficient. You want to have people who understand the potential ramifications of a breach, and how not following the best practices can present an issue for a loss exposure. So staff training is going to be very important, and it is one of the biggest gaps that can allow for security risk. So I offer just some examples of what an ERM approach would look like for a health information exchange and an HIE and a patient portal. So strategically, to mitigate some of the disruption, we want to do some internal business and see what we can develop and develop products of our own and innovate. Clinical. We want to make sure that clinical leaders are involved, especially those who would have feedback on how the data would need to be received in order for a clinician to be able to make a good clinical decision and avoid a bad outcome. High reliability tools we want to apply in financial spaces, where we want to make sure we're getting clean claims and making sure that all of the front end data is coming in correctly so that we don't have edits and denials and issues with our financial management. Human capital, as spoken about before, we want to make sure we have a good training focus. In legal, we want to make sure that the contracts are timely and give us the language that gives us enough flexibility to respond to the ever-changing regulatory environment. If there's a new regulatory edict that comes down from the government, are our contracts nimble enough for us to be able to respond quickly without having to have negotiations again? IT, we've talked about those 7 practical solutions above. For business, for our operations, we want to make sure that our processes are balanced, that we are not over relying on this automation that has come, the nice automation that has come with the HIEs and the patient portals. And then for hazard risk, we want to make sure that our strategic planners or those in leadership have developed emergency plans and hazard risk plans in case of an unforeseen event. I want to make one very, I hope, impactful point with you in my critical summary here. The clinician of the future is learning what makes the world good or bad right now. So what kind of world is the clinician of the future seeing and learning from us? Patient data communication is going digital, and patient portals now offer the kind of functionality that encourage patients to take ownership of their healthcare journey. For years, many clinicians have been frustrated by the risk associated with non-compliant patients and their inattention to post-encounter instructions from the clinician. So as patient portals and health information exchanges proliferate, we can engage patients to sign up, and more attention to their healthcare journey should follow. The internet age is proof that when a patient is given more information on their health, they become more engaged in the process. The onset of WebMD and health grades and Fitbit and the like present the healthcare community with a new type of patient. Patients today research their symptoms and they count their steps. Although it may take some time, secure messaging about labs and test results will become part of a comprehensive medical monitoring framework that becomes routine. And in the meantime, we have to address all of the potential risk from those growing pains as we try to move towards this new framework where taking care of yourself is just a part of what you do on a daily basis. So AI is not quite there. And those constraints mean that we must keep privacy and data security with all vigilance. Healthcare leaders must use the best of security solutions and processes to avoid loss. And HIEs still have a way to go. And given those limitations, we should approach standardization with a collaborative yet loose affiliation. With all of the concerns around data ownership, who's gonna have ownership of the data? How are we gonna govern between various organizations that are competing? There are sometimes transmission limitations, and are there data limitations on how much data can be sent, and the cost around it. We're going to need flexibility in our interoperability. It's going to be key that we provide that kind of flexibility. And our IT leaders already know the balance between centralization and common formats and versus decentralizing and keeping things distinct. And they know how to use these practices in their home networks and in their own health systems. So employing these principles in the same way should meet the majority of the need if we look for the best approach. If we collaborative and we're talking, then that should meet the majority of the need with the best approach. Patient portals are offered with most EHRs. So we have an opportunity there to meaningfully engage the patient if we can integrate with those social structures that make people want to use their smartphone or their personal device. So how do we make patient portal sign up as attractive as signing up for the latest app? When patients can trust portal tools, then they will provide healthcare workers with the kind of information and data and that kind of motivation and that impetus for their own healthcare journey that promotes good care outcomes. No one knows exactly what is on the horizon for healthcare. Nevertheless, we do have some understanding about what the future may hold. Clinicians know that shifts are coming in research and precision medicine. Administrators know that regulation is uncertain and that payers are essentially standing still to maintain their continuity. Government and policymakers know that the current healthcare economic landscape is still unsustainable and that the ACA only avoided the catastrophic. More legislation, both nullifying and enacting in nature, is necessary, and more must be done to lower the cost of coverage and innovation. Thank you for your time today. Thank you for listening.